Thank you. Well, my name is Kelsey Traskey. I'm the stroke coordinator at Sherman Hospital. I also work on the ortho-neuro unit as a nurse, and then I also have another nurse from the ortho-neuro unit here, and her name is Allie.
Hello.
So we will go ahead and get started. Okay, I'm just making sure my slides are moving. Okay, there we go. So what is the purpose of the human brain? So the brain is the central organ of the human nervous system. It controls both motor and sensory functions throughout the body. So when you have a stroke, this is what affects a stroke is in the brain, and based off where the stroke is in the brain, it will determine what functions of your body are affected, what symptoms you may have. So as we delve into this presentation, we'll be talking to you about what a stroke is, the different types of strokes, and what symptoms will help you recognize a stroke so you can get to the hospital as soon as possible and get care, because a stroke can be life-threatening. And we're also going to talk about what risk factors you may have, if any, and how you can ultimately prevent a stroke.
All right, so just starting out, what is a stroke? Stroke is a disease that affects the arteries of the brain, and it occurs when a blood vessel that brings blood to your brain either gets blocked or ruptures. The affected part of the brain doesn't get the oxygen and nutrients it needs, causing brain cells to die. Brain injury from stroke can affect any of the following functions: ability to move, feel, think, and behave. A stroke is a medical emergency. Immediate treatment may minimize the long-term effects of stroke and even prevent death.
So just a few facts about stroke. So if you've ever heard the term brain attack, this can be used interchangeably with the word stroke. And then although stroke is more common after age 55, it can happen at any age and at any time. It is more common after 55 just because as we age, our arterial walls can get damaged or weakened. But the leading cause of adult disability is stroke. So some people who have a stroke will make a full recovery, but more than 2/3 of stroke survivors will have some type of disability. In every 40 seconds in the US, someone has a stroke. So this presentation will be about an hour long. So you can just imagine how many people are having a stroke just during this presentation, which shows how prevalent of an issue it is. And then 2 million brain cells die every minute during a stroke. So it is very important, if you even suspect a stroke, to get prompt care, because there's interventions we can give in the hospital within a certain time frame that can reverse a stroke.
All right, so now just a couple statistics on how common strokes are. More than 9 million stroke survivors in the US currently. Every year, about 800,000 people in the US have a stroke, with about 185,000 being recurrent strokes. Stroke is the 5th leading cause of death in the United States, 3rd leading cause of death in women. About 55,000 more women than men have a stroke each year. Black people are twice as likely as white people to have a first-time stroke. And then treatment may reduce the effects of a stroke, like Kelsey was mentioning, if administered soon enough after the onset of symptoms. Really important stat right here is that up to 80% of strokes may be prevented with lifestyle changes. Moving on, we're going to talk about a couple different types of strokes that can happen. An ischemic stroke is the most common type of stroke, accounting for about 87% of total strokes. An ischemic stroke occurs when a clot blocks a vessel supplying blood to the brain. The artery becomes narrowed or clogged, which cuts off blood flow to brain cells. Another type of stroke is a hemorrhagic stroke. This occurs when a blood vessel bursts or ruptures in the brain, sometimes referred to as a brain bleed. This may affect large arteries in the brain or small blood vessels deep within the brain. The rupture keeps the surrounding areas of the brain from getting oxygen. These type of strokes are less common than ischemic strokes, which was previously talked about in the last slide. These account for about 13% of strokes, but they are associated with a higher risk of death. A transient ischemic attack is also sometimes known in the public as a mini stroke or a stroke mimic, which is a temporary blockage of blood flow to the brain. The clot usually dissolves on its own or gets dislodged. We refer to them a lot as TIAs. TIAs produce symptoms just like a stroke, but they typically last for just a short amount of time. While a TIA does not cause permanent damage, it is a warning stroke, signaling a possible full-blown stroke ahead. Their temporary symptoms do make diagnosis challenging. Stroke symptoms that disappear in under an hour do still need emergency assessment, and a comprehensive evaluation should be done within 24 hours when symptoms begin.
And then this is one of the biggest takeaways from this presentation. So this is the acronym BFAST. We're going to talk about each letter individually. And this acronym can be just used to recognize a stroke. A patient may have one symptom, may have a few symptoms. But yeah, any of these symptoms are concerning, even if, like Allie said, you experience it for a couple minutes and then it resolves. It's still important to call 911 and get to the hospital as soon as possible. So we will start off with B. So B is for balance. You could ask yourself, does the person have trouble walking, dizziness, loss of balance, or coordination? And you may recognize this in yourself or a loved one. This information is also really important to share with families, especially with the holidays coming up. Might be a good topic for Thanksgiving dinner, teach someone something that you recently learned if you don't already know the information. Also good information to maybe just hang on the fridge as a reminder. There will be a link at the end of the presentation if you want to look for, additional handouts on this, or maybe something that you could print. But balance, this could be described as maybe even someone maybe walking and appearing as if they're drunk. And I would like to add, at a elementary school, there was a stroke education event and there was coloring sheets with this information, and a grandchild had done a coloring sheet and then actually recognized this information in her grandma and called 911 and saved her. So that just goes to show how important this little tidbit is that we're going to talk about.
Next letter of the acronym is E. E stands for eyes. This could be sudden difficulty seeing, loss of vision in one eye, both eyes, blurry vision, dark spots in the eyes. Really, any sudden change in vision would be concerning for a stroke. F is for face. I think this is kind of the classic one that most people think of when they think of stroke symptoms. Facial drooping. You'll typically, just see kind of the lower edge of the lip just kind of curl down. This could also stand for facial numbness as well.
And then A is for arms. So is one arm weak or numb? And you can ask the person to raise both arms, and then the patient will hold their arms like this. And if one arm drifts down, this can be a sign of a stroke. This can also apply to the legs too. So when a stroke occurs, normally the symptoms are unilateral, which means one side of the body. So if you have a stroke on your left side of your brain, you would experience weakness possibly on the right side of the body. Again, you might not always have this symptom with a stroke. You might just have blurred vision. You might just have slurred speech, but weakness on one side of the body or numbness is very, very concerning. And then S is for speech. So you can ask the person to repeat a simple phrase. So is their speech slurred or strange? Just for a little bit extra information, slurred speech in the medical world is known as aphasia. So you can have, there's two different types, which is expressive aphasia or receptive aphasia. So if someone is having expressive aphasia, it means they're not able to express themselves or not able to say what they want to say, but in their brain they know what they're trying to say. And then receptive is they're not understanding what someone is telling them. So in order to test this, which again, don't waste time, just call 911. But if you're waiting for the ambulance to get there and you want to kind of gather more information, you could ask your whoever you're suspecting of having a stroke to name like certain household objects that they would normally know. So for example, our neurologist here, he always wears a watch and he'll point to his watch and ask the patient to name that item. And this way he can tell if they're having either expressive or receptive aphasia.
All right, last but not least is T is for time and terrible headache. A lot of us here at the hospital describe the headache that you would feel from a stroke as the worst headache you've ever had in your life. And I actually think the time aspect of this one is even more important, because if you're having a couple of these symptoms, that means it is time to call 911 immediately and note the time of when any of these symptoms appeared. That information will be very important when you do get to the hospital for the doctors that are going to be taking care of you.
And like we mentioned before, every minute that passes that you're having a stroke, 2 million brain cells are dying. So it's very important to call 911 as soon as possible. And then we'll also talk about a couple things here. Should do this slide.
Yeah.
So watch for sudden numbness, or weakness of the face, arm, or leg. So like we said, weakness of the face is a facial droop. Arm or leg could be weakness, numbness on that one side of the body. I would also like to add, I've seen quite a few patients come in and they've awoken during the night and been having numbness on, their arm. And then they turn over and go back to sleep and just assume like, oh, I maybe was laying on it and that's why it's numb. Never turn around and, go back to sleep and try to dismiss it and hope it will go away, because then you might wake up 4 hours later and you're out of that time frame to have the intervention that we're going to talk in a few minutes here. So it's very important. Don't dismiss these symptoms. Call 911 and get here as soon as possible, because at the end of the day, if you come here and it's nothing, it's much better that happens opposed to having to come here and find out that, you maybe waited too long and now you have devastating deficits that you have to live with, or a loved one. And then confusion. So this could be trouble speaking or understanding speech, like we talked about, but it also could be just you're not acting normal. Recently we had a stroke alert. This patient was out to lunch with his wife and they had gone out to eat, and a couple times he wasn't really answering her when she asked him a question, and she thought that was kind of odd. And then they went to Home Depot and he wasn't responding to his name, but he was still standing there and able-bodied, just wasn't understanding and wasn't making sense. And then even the staff tried to come over and talk to him and he just didn't know what was going on. So they called 911 and he got here and found out that he was having a stroke. And then also we had another patient recently who just didn't know how to work household objects. And this kind of first was like kind of a warning sign, I guess, or alarming to the family, was that he didn't know how to pump gas, but then they just continued on with their, day to day. And then the next few days, he didn't know how to use the microwave. So it would have just been really important just to call 911 in that moment that he didn't know how to do a simple task. And then trouble seeing in one or both eyes. This might be referred to as a vision cut. So for example, you might lose vision on the right side of both of your eyes, or it could be the left side, or it could just be one eye. So any vision change is abnormal. Get here as soon as possible. Trouble walking, like we mentioned, dizziness, loss of balance or coordination. And it could be even those fine motor skills, as simple as like being able to pick up a pen or pick up a fork when you're eating, anything out of the ordinary. And then, like Allie said, a severe headache with no known cause. This severe headache is most likely associated with a hemorrhagic stroke. And like Allie said, these have far worse outcomes than an ischemic stroke. So get to the hospital as soon as possible, because there is surgical intervention that could be done in some cases for these hemorrhagic strokes. And then if you experience one or more of these symptoms or notice them in somebody, even for a short amount of time, call 911 immediately. So there's medical options that may reduce the effects of stroke. So time is of the essence, as a treatment must be administered soon after the onset of symptoms. And then stroke strikes quickly, you should too. So like I mentioned, this time-sensitive intervention is actually a medication called tenecteplase. There's it's like not necessarily a high risk drug, but it's not a drug that they just use very freely. There's a lot of different contraindications that they'll look for and make sure that you're a good candidate for it. So most of the patients that receive this medication um, do not have any, side effects, but like, any medications, there are side effects that may occur. But if you have AFib and you're on an anticoagulant, this would be a reason that you would not get the medication because this medication also is a clot busting drug. So they will do a CT scan, which will ultimately rule out a bleed. In ischemic stroke, that clot will not show up on a CT scan right away, but a bleed will. Even if it happened 2 minutes ago, 2 hours ago, you're going to see a bleed. So they do that right away to rule out if you have a bleed. And then if there is no bleed, they look at the bigger picture. They'll look at your medications. They'll look at your symptoms. And if you come to Sherman Hospital, we have telestroke, which is a neurologist on the screen. So we have a telestroke doctor, like a neurologist, usually on the screen before you even get to the hospital if you call 911. So they'll talk to you through your med history. A pharmacist will be here looking through meds that you may have dispensed at other pharmacies. There's so many hands on board making sure that you get the care as quick as possible. So again, this medication is given within 4.5 hours of onset. So call 911 if you recognize these symptoms. And then while you're waiting for EMS to occur, maybe gather either the patient's medications or start to try to recognize when these symptoms occurred, because this will be known as the last known well. And this will be a very important question that EMS and the hospital staff is going to ask you because this will determine if you're in a window for that type of treatment. And then the effects of stroke depend on various factors. So like we said, the region of the brain that is affected. So the brain has 4 lobes. So depending on where this stroke occurred in the brain will be associated with what symptoms you're having. So for example, we have an occipital lobe and that affects vision. So most likely if you have a stroke in that part of your brain, you're going to have blurred vision, etc. And then the size of the area that is damaged by the stroke. This will determine your symptoms. So obviously, if someone has a large territory stroke, this could be more devastating and you're more likely to have more symptoms associated with this stroke opposed to if just a small little area of the brain was affected. And it could be an area of the brain the size of like a pencil eraser, like something that small. And like we said, the functions that are damaged are based off the part of the area that the brain was affected. And I like to say that strokes are kind of like snowflakes. Nobody's strokes are the same, opposed to like where it was in the brain, how big it was, what kind of symptoms the person had, maybe what risk factors caused their stroke. So yeah, strokes are just very like complex medical issues that we should always be looking out for.
A little bit more on how a stroke can affect you. As Kelsey kind of mentioned earlier, you can either have a stroke on the right side or the left side of your brain. A stroke on the left side of the brain affects the right side of the body, and you may experience some difficulties with weakness, loss of sensation on the right side of the body, speech and language difficulties or aphasia, like Kelsey mentioned earlier, inability to read, write, and learn new information. You may have a slow, cautious behavioral style after a left-sided stroke. Or a reduced ability to do math, reason, and analyze things can also lead to memory loss. And then a stroke on the right side of the brain affects the left side of the body, and you may experience some difficulties with weakness and loss of sensation on the left side of the body, depth perception or directions, vision problems. You may adapt a quick, inquisitive behavioral style. You may have the inability to paint or appreciate art and music, a lack of ability to recognize emotions in someone's voice, and also memory loss. Excuse me.
So now we're going to discuss risk factors that cannot be controlled. And again, these are things that, we have no bearing over. So they're important. It's important to be aware of your risk factors, but if you learn anything from this, I want you to take away what risk factors you can focus on as an individual. So age. So like I said, stroke can occur at any age, but strokes risk increases after the age 55. Family history. So strokes appear to have a genetic link. So you face a higher risk of stroke if someone that you have a direct bloodline to has a stroke. And then race and ethnicity. So Black people have a higher prevalence of stroke and a higher death rate from stroke than any other racial group. Gender. Women have a lower risk than men before menopause, but more women than men die of stroke. And then prior stroke or TIA. So a person who's had a TIA has a 1 in 3 more likelihood of having a stroke than someone of the same age and sex who hasn't. And then if you had a stroke, it means you are at a greater risk for another stroke. So almost 1 in 4 people will experience a recurrent stroke in the next 5 years. And it is important to note that if you have had a stroke, once you hit that mark of being 1 year stroke free from that initial stroke, your risk of having a stroke significantly decreases every year thereafter. So that's why it's so important if you make the life changes and take the medications and follow up with the doctors as recommended, and you're able to prevent a recurrent stroke, continue doing what you're doing, and you most likely will have a better outcome in the end. So now we'll talk about medical risk factors. So high blood pressure. This is known as the silent killer, and it is because you don't, if you're not going to a doctor regularly, you won't know that you have high blood pressure because generally, having high blood pressure, you don't feel any different than if you normally do. But high blood pressure can really damage the body. It can lead to a number of issues that kind of just snowball into, many worse things. So the measurement of blood pressure, the gold standard is 120/80. Anything above is considered high blood pressure. Now, if your doctor has told you otherwise, obviously go by what they have said because sometimes people, have kind of different parameters based off their own individual medical history, but textbook, it's 120/80. And then you need to work with your healthcare professional to manage your blood pressure and talk to your doctor. Like, as I said, your number may be different, but it is important to record your blood pressure at home. So we recommend to all of our patients doing it at the same time every day. So, in these warmer summer months, don't go outside and like garden and then come and sit down and take your blood pressure because it might be a little bit higher because you're, working out, or even just if you're in pain, your blood pressure may be slightly elevated just because it's your body's reaction to that. But I would recommend if you wake up, make your pot of coffee or whatever it might be. And then while that's going, sit down, take your blood pressure, and then write down your blood pressure and your heart rate. That way, when you go follow up with your doctor, you can show them what your blood pressure has been running like at home, and they can trend it and make sure that you're on the right medication, the right dose, and that your blood pressure is adequately controlled. Because some people do have what we call white coat syndrome, and it's just, you go to the doctor, you're nervous, maybe you're running into the building to make your appointment in time, and your, blood pressure is falsely elevated. So it's very important to have, that accurate number. And then diabetes, having diabetes more than doubles your risk of stroke. So high blood sugars increases plaque buildup and damage to your arteries. And this plaque, if it is building up in the arteries, it can cause them to be narrowed, and then a clot could get lodged in there, causing blockage of blood flow, which is a stroke to the brain, or a piece of plaque could break off that artery wall and then travel up to a different area of the brain, causing a clot, a blockage, and then also causing a stroke in the different part of the brain. So it just depends. And then cholesterol is also a buildup of fatty deposits and other cells in the artery walls. Circulation problems. So stroke can be caused by blockage in your arteries and veins that carry blood throughout your heart into your brain. And then AFib increases your stroke risk 5-fold. So for AFib, it's very important if you were prescribed anticoagulation from your doctor, which could be warfarin, Eliquis, any of these medications, it's so important to adhere to them. And especially if you're on warfarin, also known as Coumadin, you'll have to go to the Coumadin clinic and get your INR drawn how many times a week would that be? A couple times a week?
At least once or twice.
At least
yeah,
once or
depending.
twice a week, depending on how your labs are. Obviously, just follow what your doctor recommends. But recently, I saw someone come in. They have had so anticoagulation, if you're not aware, just causes thins your blood in your body to prevent a clot from forming. But this patient had a bloody nose, so they had cut their warfarin dose in half and thought, oh, I'll just take half because I had a bloody nose. And this was just not good thinking. They should have either gone to the hospital if they were concerned or called their doctor because they did this. They had a large vessel occlusion, which is when a large clot forms and blocks a large vessel in your brain, which causes a massive stroke, which she was a candidate to go to another hospital and have a mechanical thrombectomy, which is when they go up through your femoral artery, kind of near your hip, and send a wire up to your brain and will pull that clot out. But again, it's not something that you want to do. It could have been easily avoided by just, adhering to that medication plan. So very important. Like we said, 80% of strokes are preventable.
All right, so some lifestyle risk factors. These are the ones that you can control. Is smoking. Huge risk factor for a stroke. So we always say, if you are a smoker, stop, and if you aren't a smoker, don't start. Current smokers have a 2 to 4 times increased risk of a stroke compared with non-smokers, or those who have quit smoking more than 10 years ago. Eliminate or reduce alcohol use. Heavy drinking can increase your risk for a stroke. Recommendation is no more than 2 drinks per day for men and 1 drink per day for non-pregnant women. Obviously, if you're pregnant, you should not be drinking any alcohol. Maintaining a healthy weight. Obesity and excessive weight can put a strain on the entire circulatory system, putting you at a higher risk for a stroke. And increased physical activity will help decrease your risk for a stroke. A brisk 30-minute walk each day can improve daily health. Aim for at least 150 minutes of moderate to vigorous intensity physical activity per week. This one, it kind of just depends on your body. There's some people who have disabilities that prevent them from walking, prevent them from doing certain exercises. Really just got to find something with you and your healthcare team that is a good workout for you. Swimming, walking, even gardening, like Kelsey mentioned earlier. It's really just important that you get active for 30 minutes at least every day. And then eat a healthy diet, rich in fresh fruit, vegetables, and whole grains. Include a variety of proteins, lean proteins, fish, beans, tofu. Try to eat minimally processed foods, limit your salt intake, limit intake of added sugars, and avoid fried foods.
And then in case of a stroke, diagnosis will help determine sorry, I forgot to change the slide. Diagnosis will help determine the type of stroke and its treatment. So in the emergency room, like I mentioned, they will ask you about your medical history. They'll do a physical and neurological exam, have certain lab blood tests done, which will be those, INR and that if you're taking warfarin, because there are times where, you're in a certain limit where you would be able to receive that thrombolytic drug, that clot buster I talked about, based off lab work. They'll do the CT, which would recognize a bleed, and then the MRI, which will show either it would show both a bleed and that clot we spoke about, and then also study the results of other diagnostic tests that might be done. So these will include, like Allie mentioned, that comprehensive workup, and there's numerous different tests that will be done during a stroke workup to determine what caused that stroke. So whether it was from high cholesterol, whether it was from high blood pressure, any of those things. And I also would like to add that the stroke risk in younger adults is rising, and it's due to that, that epidemic we're in of the US just really facing obesity. So it's really important, if you're carrying that extra abdominal weight, to speak with your doctor and come up with a exercise plan, like Allie mentioned, like, maybe the elliptical, if you have joint problems, would be easier on the joints opposed to running, or, one of those recumbent bikes are good for cardiovascular health. So that exercise is really important to prevent a stroke. Anything, just keeping your heart rate up and making sure it's maintaining to fully exercise that hard. Not to get too overwhelming anyone with information, but like that high blood pressure we talked about, all of these risk factors are linked in some way. So it's really important to control what you can. Because, for example, if you have high blood pressure, over time that will damage the heart muscle and it can lead to AFib. And depending on your medical history, there are different options you could speak to your doctor about, like anticoagulation, or there are different procedures they can do in the heart that can help prevent a stroke and to the point where you will not need anticoagulation. So again, I always tell people, don't go to the doctor when you're sick. Go to the doctor before you're sick to prevent getting sick. So it's important. Go in for an annual physical. Just keep up with those appointments. And I like to live by my word. So like I told my husband, when we get married, we're going to the doctor, because, when I was in college or living in a different state, it was kind of hard to keep up with those doctors, but I want to, do what I preach. So I recognize that too, and go to the doctor, because you never know what's going on internally. You might feel perfectly healthy, but there could be a number of issues wrong. So it's really important to get that checked out. So often we see people come in and they're not on any medication and they have no reported medical history, but they say, well, I haven't been to a doctor in 50 years. And it's not something to brag about, not having to go to the doctor. I mean, it's good to not be sick, but there's no shame in going to the doctor.
Just kind of piggybacking onto what Kelsey was saying, just kind of, creating a healthier lifestyle for yourself can kind of make not just stroke, but all these different health, complications that we've been talking about, just kind of decrease the risk with all of those things. Going to talk a little bit about Life's Essential 8 is just, a checklist for lifelong good health. Better cardiovascular health helps lower the risk of heart disease, stroke, and other major health problems. One is eat better. 2, be more active. 3, quit tobacco of all forms. 4, get healthy sleep. 5, manage weight. 6, control your cholesterol levels. 7, manage blood sugar. And 8, manage blood pressure.
And then just a few more tips to be healthier and reduce your risk of stroke. So take your medications as directed. I would like to add, if you have high cholesterol, you'll most likely be put on a medication called like atorvastatin or rosuvastatin. These medications end with that suffix statin. So it's really important. Some people do have intolerance to these medications. Some people may have intolerances to other medications, but it's so important. If you feel like a medication isn't making you feel well, talk to your doctor, because there are alternatives out there opposed to just taking yourself off of it. With our advances in medical science, there's so many different options. It's very important to see what your other options are. And also, everyone's body's different. Some people might say like, oh, this medication didn't work for me. I hear those conversations especially common with, our psych meds. Like, if you're on a medication for depression, someone might say like, oh, Allie, I took Lexapro and it made me feel terrible. I hated it. And then, that might deter Allie from wanting to maybe go try that medication. It goes for all medications. So it's so important to make those decisions for yourself opposed to, just listening to what maybe someone else said. Also reducing stress, which may contribute to behaviors such as overeating, lack of physical activity, unhealthy diet, and smoking. So I know this is easier said than done, but most importantly, just focus on what you can control. So if you have a lot of difficult things going on in your life, it might be hard to avoid that stress, but maybe you can find something that brings you some joy, whether it be like just reading a book, or going outside and taking a walk if it's nice out, and maybe listening to like an audiobook or a podcast, or maybe your favorite music. anything like that, you know, small life changes can really help the big picture in the end. And then having regular medical checkups, so including assessment for your risk of stroke, like I mentioned. And then on this slide here, you will see that link I spoke about for more information about stroke.